Welcome back to Midday Kentucky, everyone. Well, Dr. Matt Hall is here in the house from KORT Physical Therapy. Welcome to the show.
Thank you.
Welcome. Happy New Year, my
Happy
friend.
New Year.
Now, I know there are times in your life that you feel that there is something wrong, but you don't know what. And that's where someone like you, Matt, steps in and starts to look at the physical side of the issues, and especially when it comes to insertions in your shoes as well.
That is correct.
Okay, one of the products that you've brought in here today is the ScanCast 3D laser. What exactly is that, and how does that help all of us at home watching the segment?
Well, it's basically like a copier. You place the foot on a screen, and you're going to get a scan of the foot in 3 dimensions. So we'll
okay, I'm going to do that while you're talking.
Okay.
So what are the advantages of scanning your foot?
Okay, you just go ahead and hold your foot there.
Yes. So why are we doing this?
Well, we're scanning your foot so that we can get a 3-dimensional image,
Yes.
so that we can actually have an orthotic fabricated custom for your foot.
Am I done?
Yeah, you are. And you can see on the screen there,
Yes.
you'll get almost like a topographical the first time you do it.
Oh.
And so it'll actually show the high points and low points, and then the orthotic itself can actually be fabricated to those specifications. The advantage of this device over how we did it before is that now this can actually turn the turnaround time to about 2 weeks. So from the time we scan your foot, we can have a custom orthotic back and ready to go in 2 weeks.
How do we know we need one?
Well, that's where your examination comes in. So many people that come for foot and ankle pain may or may not be appropriate for an orthotic. But your physical therapist can do a full screen. Part of that might be a running analysis or a walking analysis, so we can sort of see where the issues lie. Because the last thing you want to do is spend money on something that's unnecessary. So that's where the examination comes in on the forefront. But now with this device, we're able to actually, again, increase the turnaround or decrease the turnaround time substantially. So that's a cost savings for the patient. It allows them to get in their shoe much quicker and get them back to recovery much faster.
So what are some of the advantages to being scanned by a physical therapist? I know a lot of people have custom orthotics, some friends of mine, but they didn't have it scanned by a physical therapist. So what are the advantages there?
Well, again, it all comes back to the expertise of your therapist that's going to be doing the examination. I mean, we probably spend at least 30 minutes examining the foot, ankle range of motion, strength, balance, proprioception. Again, we may get you on the treadmill and do a running analysis.
Oh, I've had one of them. They're good.
Yeah, great. And looking at your shoes, and we look at all those things because, you know, it may or may not be the fix that you need.
Okay, well, Dr. Hall, I want to ask you, what are some signs at home, for everyone watching us at home, before they call you, what are some signs that people have that they might need to call you? Is it a bad back? Is it feeling you're not right? Is it wear and tear on your shoe that's not normal anymore?
We look at all those things.
Okay.
I mean, I think a lot of people try to be preemptive with trying to do things ahead of time, and that may or may not be the best way to approach this particular device. But if you have foot pain that's been dragging on for some time now, or back pain, or hip or ankle issues, there might be something going on there biomechanically that an orthotic could be a great benefit to you.
Good.
And
Well, that's amazing. Such a quick turnaround, because I know people that have tried to get custom orthotics and it'll take months to get it. So you're saying 2 weeks.
2 weeks, 2 weeks.
So how can people schedule that with you? Do you book far out, or can you get right
No,
in?
it's just a matter, we guarantee appointments within 24 hours. Right now, currently, we're doing this at the Tates Creek location now. You can reach that number on the screen here in a few moments. But we're also going to be able to do other things as well besides the ScanCast 3D. We have other options as well for folks that are on a continuum as far as cost, if they're concerned about cost. We can do things that are a little on the cheaper side and kind of move up to something like this.
Yeah, does insurance
I was
cover
about to
any
say
of this?
exactly
I
the
know
same
we were about
thing.
to ask you that.
Most insurances do not cover a custom
Okay.
orthotic, so
Really?
it is an investment, but I tell people all the time, if you're going to invest in something at home, invest in a nice bed, and invest in a good pair of shoes. Again, the orthotics I think could be a great...
You're preaching to the choir here when it comes to the shoe, my friend. We like a good shoe.
Thank you so much for coming in. We appreciate you taking the time.
Thank you.
Well, stay